support people overcome their anxiety, overwhelm, and fatigue through integrative approaches, combining medicine, exercise science, nutrition, resting techniques, and health coaching. So, today's topic is postpartum anxiety. And yes, it's something which is a relatively unheard term of, and we are not really very well versed with the postpartum anxiety. Luckily, we all know very well about what postpartum depression is because there has been some awareness. But postpartum anxiety is something which goes kind of unmissed. If you guys are interested, you can follow me on my Instagram account. That is Dr. Gauri, that is Dr. Gauri_9. So that's my Instagram handle. And you can just, if you want, if you have any more questions, you can just DM me over there. So I will start off with the questions now. Okay. I hope I'm audible, visible to everybody. Can I just get? All right, great. So I am audible. So we will just straight away dive into the questions now. Okay. So what is postpartum anxiety really? So when you're experiencing, so basically, I'm assuming that everybody knows what postpartum means, right? It is a period of time which is after a childbirth, right? So a lot of people like to call it as fourth trimester, and a lot of people believe that postpartum period ends. Some people believe it ends at 40 days, it ends at three months, but I believe it goes on for a much longer period because physically, mentally, we need some time to actually come back to our own self. Even sometimes physically a person comes back to the normal cells, but emotionally it takes quite some time to actually get adjusted to the new life. So postpartum anxiety is something which is not merely a baby blue. Okay, it is something where you are having symptoms of worrying. Now you may say that worrying is quite common, and that's right. Worrying among parents is quite common because it's like a defense mechanism. And we'll start off with why you worry firstly. All right, you must have heard about the term mom brains, right? And it, as it says that, like the mom brains are, many people are like, mom brains work in a particular way. They don't think rationally, and there are so many things around it, and there are a lot of people making fun of it. But here's the fun fact: the mom brain, now there have been a lot of research on this and a lot of studies on this. The mom brain is something which is highly focused and highly developed even before the child, it was before the childbirth. This is because so that you can understand the cues, the hunger cues, and subtle signs of the newborn which everybody else might miss. So the mom brains are something which is like highly focused. It makes you very, very focused on your child, and that's why you tend to get more alert, wherein you start just taking care of your child, and just start reciprocating to the needs of the newborn. Now, physiologically and according to the evolutionary point of view, it is absolutely normal to care more and heightened sense of alertness to be there. But when does this actually start becoming a problem is when you start getting symptoms of anxiety, which are hyperventilation, which is palpitation, which means your heart rates increase without any reason. There is a lot of sweating, and you start worrying about a lot of things which are not even present there. You start probably checking on the internet whenever you get the slightest different symptoms in the child, and you immediately start seeking out for help because you feel that you're in a constant danger. Now postpartum anxiety actually comes under, it's a huge umbrella. Right, anxiety itself is a huge umbrella under which there are a lot of different things. Firstly, there is OCD, which can also be postpartum OCD. Then there is PTSD, that is post-traumatic stress disorder, which can also be seen in after pregnancy or postpartum PTSD. There is panic or panic disorders, which again can be seen in postpartum. Uh, it is very common to see. So postpartum anxiety is something which, there are different sections, and unless and until you do not figure out that how you're feeling, it's very difficult to actually understand that you are facing these things. So now, how I've got another question: how common is postpartum anxiety? Now, postpartum anxiety actually, worldwide, there are anywhere between 18 to 25% of women face postpartum anxiety. But this is something which we have to understand, that it's a relatively newer term, and a lot of cases go unreported, whether it is in underdeveloped countries, whether it is in the rural areas. We do not see a lot of people reporting. A lot of people don't even understand that the worrying is something which is abnormal, and not just mere baby blues, because a lot of times even the family members would just not reciprocate well to them and tell them that this is temporary, and a lot of stigma is there around it. So usually it is being shut off even by the close friends and family. So a lot of times it is not reported, but it is seen in 18 to 30, 18 to anywhere between 18 to 25% of cases. The next question is, what is the difference between postpartum anxiety and depression? So postpartum depression has also got a lot of symptoms which the actual depression is seen. In postpartum depression, there is loss of appetite, which is very, very starkly seen. I mean, it's like a mixed bag, the symptoms. It's not like all symptoms are seen by everybody, but usually there's loss of appetite. A person cannot sleep well. They do not find interest in a lot of things. There are also chances that the person may have suicidal thoughts. Whereas postpartum anxiety is something where you start worrying about the minutest things. The moment the child does something which is away from normal, they start worrying about it. And for example, if the person is and again if the person is working, or they have started already going to work, and if they have left the child with a caretaker, there's constantly this wheel of thought going on, that whether the child is safe, whether the child is okay. If they are themselves taking care, they will make sure that everything is very clean, everything is being sterilized again and again. And they start getting very paranoid with slightest of changes in the structure. So also postpartum anxiety, it is not just related to the child, it is oftentimes related to different areas of your life. Now, for example, if you are more career oriented, there are chances that you will be getting anxious about missing out on a lot of things that have been happening at your workplace. And as a result, it will cause you an anxiety. If you are worried about your own health, again, you will be worried about your own self if there are certain changes. And again, you will be constantly worried about what is happening to you, how are you feeling, because your body needs recovery. So this is something, so a lot of changes keep happening, and you start worrying more about it. Now, next question is, what are the main causes of postpartum anxiety? All right, so the main cause is childbirth. Birth is a huge event, and there are a lot of hormonal changes. And there are chances that if you have been suffering from anxiety even before, there are chances of you developing anxiety even after childbirth, and if it is not taken care of in the first place. But the main causes are a lot of hormonal imbalances, and recovery takes a lot of toll, because especially if you are a C-section mother, especially if you have had a premature birth. So these are the cases which kind of puts a person in on high alert. On the top of it, if the nutrition is not good, on the top of it, if you are not taking the right approach, there are chances for the anxiety to aggravate furthermore. Now, what are some of the risk factors of getting postpartum anxiety? As I mentioned before, if you are, the most important and the most common risk factor is if you are already facing anxiety before the childbirth, there are good chances that you'll be facing anxiety even after childbirth if it's not being taken care of properly. Then again, if your mom was or your grandmother had faced. Now it's a little difficult to find out, but then you can just talk more and get to know that how they were during their postpartum period. So it is often hereditary as well. Another risk factor is if you have been on certain medications, even that causes postpartum anxiety. Uh, yeah, so are there any more questions? Am I audible and visible to you? Nana? All right. So, yes. So, it is important for us to understand. I think those are the questions. So it is important for us to understand that anxiety is something which can be taken care of, and you don't have to be alone. So after childbirth, we all know that we require, you require a village to raise a child. Okay, there's another question. I'll just come back to this question after this point of mine. So childbirth is something which is a huge event, and after that we also, it is rightly said that we require a village, and by that we mean that we don't just mean that we require family members, extended family, or your friends, but it also means that you need to have a very very solid brigade of the postpartum caretakers. Okay, so and that also consists right from a physiotherapist who is who is actually qualified in taking care of postpartum women. Then there is a lactation consultant, then there is a sleep coach, then there is a good masseuse who will take care of you, there is a good therapist. You need, a brigade, a very very solid brigade who will bridge the gap between your health and you, because these are the people who are well qualified, and these are the people which actually help you to go through all these different changes and reassure you, because most of the times a lot of you get a lot of opinions from different people, and they are all well-meaning people, but you have to understand that every parent or every female has her own journey with her child, and as they say, pregnancy does not come with a user manual. You have to really navigate everything. So if you have a support of these qualified people around you, it really makes the journey easy. So also postpartum anxiety, I know it will be a little this thing, but then it is also seen in gents. So after they become a father, they also face a lot of different anxieties. I've had a couple of patients who were really really worried about their child, which was not very normal. They had this heightened sense of worry, which really came into their day-to-day day-to-day life. So it can be faced by both the parents, so it has to be taken care of. So make sure that you talk to everybody. Okay, make sure you talk to people around you, you let them know how you're feeling, because that is something which is also going to give you it's going to help people and around you to take better care of you. Okay, so I've got one more question. So एंजाइटी अगर हो तो हमें क्या करना चाहिए, इसके लिए कोई ट्रीटमेंट लेना होता है क्या? ओके, सो अगर आपको पोस्टपार्टम एंजाइटी है तो उसके लिए ट्रीटमेंट की ज़रूरत डेफिनेटली पड़ती है. ओके, तो आपको अगर मेडिकेशन स्टार्ट करने की ज़रूरत पड़े तो यू हैव टू मेक श्योर दैट यू firstly you take medications only from a proper doctor, or not from kahin se over the counter medications and all, because as you all know, when you are lactating or breastfeeding, a lot of medications pass through the breast milk. So you have to make sure that you let your you consult a proper doctor, and they also give you the right kind of medication which are safe during breastfeeding. Uske liye or amazing treatment is homeopathy. I'm a huge advocate of homeopathy, because homeopathy के treatments जो होते हैं, they go to the root cause, and उसके तुमको साइड इफ़ेक्ट्स भी नहीं होते हैं मेडिकेशंस के. दे आर ऑल सेफ ड्यूरिंग ब्रेस्ट फीडिंग. सो होम्योपैथी इज़ समथिंग विच यू हैव टू रियली गो, यू कैन रियली गो फॉर. उसके बाद यू हैव यू नो बिहेवियरल थेरेपीज़, डिफरेंट डिफरेंट टाइप्स ऑफ बिहेवियरल थेरेपीज़. एंड जैसे उसमें आ जाता है REBT आता है, CBT आता है, एंड अ लॉट ऑफ डिफरेंट बिहेवियल थेरेपीज, जिसकी वजह से आपको जो रूट कॉज है, आपके मन में जो कुछ चल रहा है, वो सीड्स वहीं से तुम्हारे जो थॉट्स है उनको निकाल के नए थॉट्स इंस्टॉल करते हैं. एंड उस हिसाब से आप आगे जाके उस चीज़ का लाइक यू नो विद अ न्यू पॉइंट ऑफ व्यू यू कैन परसीव द थिंग्स देन. और उसके बाद फिर देर आर अ लॉट ऑफ डिफरेंट यू नो रेस्टिंग टेक्निक्स, योगा. Like for me personally, when a person comes to me with an anxiety, whether it is postpartum anxiety or it is a normal anxiety, I just don't take very bracketed approach. I take a very wholesome approach, very integrative approach, where I make plans for people which includes exercise science, resting techniques. I use medications also if required. I use nutrition. Nutrition plays a huge role. तो आप क्या खाना खा रहे हो, कैसे खा रहे हो, even that is important. What are the beverages that you're consuming? अगर आपका coffee intake ज़्यादा है या नहीं है. So basically treatments है definitely. This is very very treatable, but you have to really make sure that आप किसी qualified person के पास जाइए जो आपके root cause पे जाए और वो एंग्जाइटी कहाँ से रूट हो रही है. बिकॉज कैसे है ना कि जैसे हम लोगों ने स्टार्टिंग में बात की थी, दैट इज़ PTSD, दैट इज़ OCD. सो इट इज़ वेरी इंपॉर्टेंट फॉर द हेल्थ केयर प्रोवाइडर टू अंडरस्टैंड वेयर योर एंग्जाइटी इज एक्चुअली रूटिंग फ्रॉम. एंड व्हेन दे आर एबल टू पिन पॉइंट दैट दिस इज द मेन कॉज ऑफ योर एंग्जाइटी, so that root cause can be eliminated rather than just giving a blanket approach. Okay, I hope this was helpful. Any more questions? All right, there aren't any more questions. So yes, so you just have to make sure that you talk to somebody, you understand, you let your spouse, your partner, your primary caretaker know that you are actually facing through anxiety, and it is something which can definitely be dealt with, and you don't have to live with it alone. There's a support system outside. You just have to extend an arm, and you will be able to get rid of postpartum anxiety, or rather manage it more effectively. Okay.